Thank you very much. I'm very pleased and honored to be here. It's extremely an important topic for me because as somebody who's not a believer, what I do know is that we need to address the needs of people living with HIV in churches, in mosques, and in temples. When we are able to welcome people living with HIV in communities, in religious settings, then I think we will just about solve the issues associated with stigma and discrimination. So what we don't need. We can remember back to Mother Teresa, who said about AIDS, it's just a retribution for improper sexual misconduct. What we do need is what we're calling positive health, dignity, and prevention. Positive health, dignity, and prevention is a shift from laying blame on HIV-positive people to supporting the health and well-being of people living with HIV. So why do we need to do this? We need to improve the quality of life of people living with HIV. That's what we all want. We want to reduce stigma and discrimination of people living with HIV and keep populations. We're not going to win this if people are underground because they are MSM or sex workers or drug users. We need to find a way to address this within a community setting so that discussions can take place, there's dialogue, and that we can work together to prevent the onward transmission of HIV. I've got this lovely vision of having an adherence support center and a hairdresser. You know, women often take a long time to get their hair done, so why can't they get counseled on, at the same time, on adherence, get their refills there? You know, if you're gonna sit somewhere for 2 hours, you might as well, you know, do something useful for it. There's no need to have a doctor to sit there, and besides, you know, I've had a lot of doctors in my time, and most of them aren't really good at talking to me about sex. People living with HIV draw comfort and strength from faith communities. It's clear that most people living with HIV are adhere to one faith or another. And for them, their faith is extremely important. And the fact that they have HIV doesn't take away the importance of their faith, and it's something that we need to remember. And as I hinted to earlier, I strongly believe, and I'm putting a lot of pressure on you, but I strongly believe that you have the key, faith communities have the key to solving the greatest barrier to stigma reduction, as well as to access to treatment, prevention, and care, which will come once stigma has been reduced.
Overall, as I said, this journey has brought many reasons for joy and success. But the deeper question must be, what better could we have done? Why should we have allowed millions of brothers and sisters like us still to continue to bear the brunt of the disease? And here are some things that I want to go within the HIV/AIDS framework, and as we look at what the dimensions of the epidemic is, but also beyond it. Because we are all citizens in some ways of this shrinking global village. The context of social injustice still prevails. The context of every child not being able to realize his or her own rights is a reality. And this is why in the broader context of these injustices and these failed promises, we have to also place our question of what can faith communities do? Because we don't live in a vacuum. The virus doesn't live in a vacuum. The fact that this epidemic has a young face and the face of many look like me, women, is not something that is happening just like that. There is a long trail of injustice. There's a long history of discrimination. Those questions have to be questioned again. Those questions have to be placed at the heart of our conversations again, because then the discourse on HIV/AIDS will also stand to benefit. Religious communities and faith communities know the language of love and compassion. They have, from time to time, always requested not only their leaders but their believers to introspect, to reflect, to be accountable to that greater power that we have to transform and change. Why wouldn't we use that in the broader context? Why wouldn't we renew that promise to question ourselves more sincerely and more honestly, not just in our small parishes and temples, but also in the public gaze of everybody? I'm reminded 60 years ago what Mahatma Gandhi said when a journalist asked him, Mahatma Gandhi, you said something else on this particular statement 2 years ago. And he looked at the journalist from the United States and said, "You have forgotten I'm a human being and I have the ability to change over time. I have the capacity to evolve as a human being, and that is my hope." Brothers and sisters, that is the hope we must carry forward, that we have come a long way. We must question, we must work, we must challenge ourselves for renewal and for caring of everybody in our community, but we must not forget that the transformation that we are capable of gives us so much more energy than what divides us.
The faith community has been in the front line in the response to HIV and AIDS from the earliest days of the epidemic. This involvement has ranged from prevention education in schools, hospitals, and religious settings, to care for orphans and vulnerable children, and for families affected by HIV, to the provision of hospital and clinical care. So the faith community has already made a very significant contribution to the universal access achievements. And faith communities obviously have been important sources of pastoral and spiritual care. Can I just close this? Yeah. To people living with HIV and their loved ones. The role of faith communities is a key one in a broader civil society engagement in the response to HIV. Not just as service providers, but because of their proximity to people's lives, to families, social networks, and intimate relationships. Responses to HIV go beyond the scope of health systems, into the very fabric of people's lives. And exactly there, their religion can act as a powerful force for cohesion and motivation. At the same time, and it has been referred to by previous speakers, faith communities have struggled with aspects of the AIDS response. Please allow me a few personal thoughts. In my opinion, an effective AIDS response is based on a combination of moral and practical principles. And this is exactly where faith communities and government institutions and others involved in the fight against AIDS can and should work in complementary ways. The recent UNAIDS report, released a couple of days ago, showed that young people are leading the prevention revolution. New HIV infections among young people have declined in 15 out of the 25 most affected countries. Young people get sexually active at later age, they have fewer sexual partners, and they have safer sex. I believe that this is a collective success based on a comprehensive approach that combines moral and pragmatic principles. Such comprehensive approaches cannot be reduced to simplified messages. Prevention campaigns that only promote the use of condoms will not be successful. At the same time, campaigns that limit their messages to abstinence only will also not be successful. Safe and responsible sexual behavior requires a full package of interventions that go beyond ABC and include education, the elimination of violence against women and girls, banning stigma and discrimination, and many more. Stigma and discrimination, also highlighted by the previous speakers, are main barriers to achieving universal access, and probably the field where faith people can and should contribute most. I would like to end with a plea for continued dialogue, and when we ended the meeting in March, I committed myself personally to remain in dialogue with all of you. HIV/AIDS touches on moral and practical issues at all levels: individual, families, communities, and societies at large. If we are to make a lasting impact on the epidemic, we need to build bridges across all those involved in the fight at all levels, focusing on those factors that drive the epidemic. Be prepared to listen and learn from one another. Identify ways of working together on the basis of complementarity and exploit synergies. Feel confident enough to leave our comfort zones, challenge each other, and maybe even more importantly, challenge our own thinking. Let's keep talking and listening to each other. Thank you.